Welcome back, America. I'm Hugh Hewitt. Americans for Prosperity, one of our great sponsors, and they have an organization with which they partner and with which they align, which is Concerned Veterans for America, which you can find at cv4a.org. cv4a.org. And their boss, John Vick, Executive Director of the Concerned Veterans for America, joins me. John, welcome. When AFP said, hey, talk to John about the Access Act, I got to confess, I don't know anything about it. I'm a civilian. Tell me about it.
Yes, sir. Well, that's why I'm here. The Veterans Access Act is a landmark piece of legislation that's really going to improve veterans' quality of life in terms of how they receive not just health care, but also mental health care, right? So how they take care of their minds and bodies. One of the fundamental issues with post 9/11 veterans, we have all these new veterans in the system, is sometimes wait times to get care at a VA hospital can be really, really long, right? And so what the Veterans Access Act does is codify community care access standards so that you can go down the street to the same place the rest of your family gets their health care if you need to, so you don't end up waiting for a long time. And I would say apart from that, just the other really exciting news for us is it includes pilot programs for full choice on mental health and substance abuse care, right? So veterans that might be dealing with things like post-traumatic stress disorder or military sexual trauma or dealing with a substance abuse issue like alcoholism or drug use. Oftentimes the window to get help for those things is a day or two, right? You don't necessarily have 65 days that you can wait to get your appointment. And so whether it's at a VA hospital or at a minute clinic, right? As soon as you're ready for help, you ought to be able to get it. And this law makes sure that VA has your back.
John, who would be opposed to this? Obviously, I think vets are beloved in the United States, and everybody knows the VA has got problems. Who in the world would be opposed to this?
Yeah, well, I think, unfortunately, over time, you have sort of knee-jerk political reactions anytime you talk about taking a government-run healthcare system and putting more of the control in the private sector, right? And so this debate goes all the way back to the origins of Obamacare, and essentially, I think there are good faith arguments that some people have made where, like, well, what if a veteran gets help outside of the VA system, and then the VA does need to work on them later on? Are they going to have those records? But at the end of the day, those are the same issues that the rest of the U.S. healthcare industry addresses all the time with records, transport, that sort of thing. So none of the problems.
John, years ago, I had an intern, and he had done tours in Afghanistan and Iraq, and he couldn't sleep. He had PTS. I could not get him an appointment at the VA. I called senators and congressmen. I could not get it done. That's how bad the system was. It was. Yeah. I was astonished.
Yeah, no, it's really incredible. And the doctors and nurses that work at the VA are really, really good people, and the vast majority of them do really great work. But the VA is a leviathan bureaucratic organization, right, with huge amounts of overhead. And so you do have pain points in the system. And at the end of the day, it's not about the dollars that we spend, right? Throwing more money at it doesn't necessarily fix a bureaucracy, right? What we need to be focused on is service delivery to veterans. And that if you give them more choice, they will get those services for sure.
Now, is there within the VA, an institutionalized capture that they resist any innovation? That is the case with a lot of government agencies. I just don't know the VA. I think Secretary Collins is a good man, so I assume he's trying to push back on that. But is that a problem, capture?
It is, yeah. I mean, and this battle goes back to 2018 when we got the Mission Act passed. It was a landmark piece that CVA also worked on, which introduced community care. And once COVID hit, and then you had the Biden administration, you basically had a lot of bureaucrats at the VA that kind of viewed community care as, well, that means we can't do our job. And that's really not the case, right? The VA is huge, but it's about 170 medical centers. The United States is a very, very big place, and there are millions of veterans to serve. So there's just a lot of situations where it makes a lot more sense financially as well for veterans to use the private sector. It's really just a matter of, in the military, it's the difference between you may, which is what the Mission Act was, and you shall, which is delivered with a knife hand. Veterans do have this right. Congress has made this promise. The Veterans Access Act will make sure that it happens.
I want people to learn more about it at C as in Charlie, V as in Victor, the number 4, A as in Albert.org. CV4A.org. That's Concerned Veterans for America. CV4A.org. John Vick, thank you for spending time with us to tell us about this, and we'll try and get people to go over to CV4A.org. CV4A.org.